Great, and we do have time. I'll ask you, are we going until about 10 after? That's about when we started, is that we've got permission? Because I don't want to have falsely promised you that there's some time for discussion and questions. I think our microphones are still out there and working, and we saved all of the questions and thoughts, your thoughts, until the end. So feel free to ask of anyone or comment.
Excuse me, I'm not voting for mine.
I can repeat it.
Note has mentioned the peer relationships between siblings that are adopted and those that are not adopted.
The question is about peer relationships between siblings, those that are adopted and not adopted. We haven't talked about that today, and I'm wondering if folks have any knowledge or thought about that, and if not, then we'll find out what's out there. We may need to turn these on. They're on. Anyone here?
I would say we had a conference on siblings and adoption and foster care, and there's all kinds of layers of issues, but one that comes in when the adopted sibling has huge issues that take a lot of parental attention. Often the kids that are functioning normally have a lot of resentment over all the resources in the family going to this one kid, and maybe more than one kid. And those issues, parents need to be really sensitive to those issues, not allow the problems of one child to take away from the children that are doing fine, not allow the kid that's acting out to destroy property of the other child without there being some compensation. You know, that's not all the issues. There's other issues, and adopted children within the same family have different issues. Some families have birth, foster, and adopted children, and for the most part they do fine, but you know, there's different issues with different kids like in any family, and it's sometimes hard when you have to individualize the different and attend to all of those. That would be my answer to the question.
I guess what I would add is, again, with the real variability in families where there are a biological child and adopted child, with families who adopt older children who come into the home with a fair amount of emotional disturbance. Sometimes you can see challenges around safety for the children already in the family, and so that has to get navigated, and parents have to figure out how to navigate that. You also will see families where the child who is the biological child of the family develops a sensitivity and connection to the adoptee, with the adoptee, and in some ways can help parents better understand the adoptee's experiences. Mm-hmm. So I think the relationship between siblings, the possibilities, run the gamut in terms of the range from positive, mutually supportive and helpful experiences to ones that have to be carefully navigated by parents as well.
Yeah.
As my name is Phyllis Lowinger, as both a parent of children that are mine by birth and adoption and a professional in the field, I think my experience also offers the perspective, which I think needs to be discussed more, is that having a child by birth and adoption gives the opportunity to see much more early on the differences between raising a child by adoption and birth. That you have a child, that you have to deal with the complexity of having come from a birth family. I like to tell the story regarding whether it's temperament or whatever, is that my daughter by birth would basically, and I'm using this in a loose way, would become psychotic when she was hungry. And I always said that I would have put her in therapy if she was mine by adoption, but because it was a common trait for myself and my mother's side of the family, it was looked at as perfectly normal. So I think that's a very important issue, what the parents bring to the differences and their understanding of that.
I would agree. I think you articulated it very well and gave an excellent example of what some of the benefits can be for families who have a biological child first. We know some of the challenges that can come to families when they adopt first, in part because they may not be able to conceive and then are able to conceive, and how families navigate having an adoptee first and a biological child second can be great, and sometimes it can be challenging.
Okay, how about here, and then we'll get to you.
Okay.
Go ahead.
So, first of all, thank you so much to the panel for building on Megan's wonderful presentation in such a powerful way. You've really shown the complexity of the different aspects of development that are relevant to the children and young people and their families. One of the themes which connects many of the things that we heard just now, and also from the conversation that we've just been having, is the theme of empathy. And we've heard a lot of different ways in which empathy can be relevant. Parents' contribution, siblings' response, and of course the children and young people who've been adopted themselves. But empathy, we're beginning to realize, is a multifaceted phenomenon itself. You're not just high on empathy or low on empathy. So we find in our work with maltreated kids that very often there will be intact emotional responses to events in their lives, and seeing other people respond emotionally triggers something for them. The difficulty is how we actually scaffold the transformation of that emotional response into behavior, into pro-social behavior. And I wondered whether any people on the panel and those in the audience might have some thoughts on how we can use the kind of work we've heard about this morning to actually scaffold the translation of empathic responses, because we feel strongly in these situations, how we translate that into positive action.
Are you talking about for parents or for kids, or both?
I think it's both. I think it's about the support that we provide for parents, but it's also about, in turn, the support that the parent provides for kids.
So, working from an empathic lens, I just want to make sure that folks in the back heard all of the comments made. No? I'm going to take a shot at paraphrasing. It's an excellent point. He talked about a running theme across the presentations being that of empathy, and that it's multifaceted, and that we can have the felt experience of feeling empathic and it not necessarily translate into empathic behavior. And so how do we scaffold the feeling into behavior? Is that a good representation?
One of the interventions that I mentioned toward the end of my presentation, which I didn't really get to explain, but I think they do a good job of addressing many of the layers of that. In the ARC model, there's a component called caregiver management of affect, and another component where you really become attuned to your child, observe the child, figure out when they lose it, what's stressing them out, how to address this. But in the caregiver management of affect, the caregiver really has to deal with their own feelings, what triggers meltdowns for them, and not being able to address the child's issues in a rational, therapeutic way. And building in more support. Sometimes the husband and wife are divergent on their perceptions of the situation and what the solutions are. And, creating a unified team between the two parents, helping build in support so that the caregiver can learn to manage their own issues and emotions and receive support, sufficient support, to be able to do so in whatever forms that may take, whether it's respite or, a support group of adoptive moms or whatever. And there are a number of social skills. That model is built on a number of evidence-based practices related to social skills training and cognitive behavior therapy and others, where they use, and in Karen Purvis's thing, she has techniques where she'll tell the kid, use your words, like when the kid is losing it, that, she would get down at the level of the child, look the child in the eye, talk very softly, and say, and really try to get the child to move from meltdown to articulating their feelings, identifying what their feelings and needs are, and working toward using words to express feelings. And the whole theory of mind thing can be developed and taught and built over time. It's part of the social skills training. So building in modules and components of what these deficits are, if the intervention fit, the Swiss cheese holes, that can be done, I think, in a concerted way over time. I don't think it's done in 8 weeks or easily, but you can teach parents how to parent, and it's called therapeutic parenting in my list of parent skills, in such a way that you help the child develop the skills to identify and express feelings, and you teach them how to deal with feelings in a healthy way without melting down. So that would be my approach.
If I could react to your big picture question with the big picture answer, I don't believe that as a society we're very empathic towards adolescents in general. We tend to, as adults and in public policy, we think of adolescents with a lot of ambivalence. We like our adolescents, our kids, but we don't like what they do. And we're very concerned about all the things that they can do and we don't like how they can be sarcastic and all these other sorts of things. So as a general rule of thumb, our greater social ecology is not designed to be empathic towards adolescents in general, much less adolescents who are adopted. Now that's a different kind of commentary than about trauma and that sort of stuff, but just a reaction.
Let me say a couple things too. I also see that often operating on 2 different levels. So you might have a child who comes in and they're copying the other child in the home, and on a superficial level they're kind of indoctrinating themselves toward some theory of mind, kind of a fake it till you make it. And yet at the same time, maybe there's some attachment going on, maybe there isn't, and that can happen in a more instinctive, organic way once you have all those networks in your brain around real felt, deeper level instinctive connection that leads toward empathy in a different way. And then sometimes those two interact. And then I think a third issue that's interesting is the whole idea of projective identification and inducement, where, going back to what Susan was saying about parents, sometimes the child's behavior by some is interpreted, that negative behavior is interpreted as a way to say, this is how I feel. And the parent ends up feeling abandoned or hurt or, isolated. And it's sometimes viewed negatively, like the child's being aggressive, but it might be that the child in some way is trying to help the parent understand what that feels like so that there can be empathy back toward the child.
I also just want to maybe put a footnote to the empathy discussion, and that is just highlighting again that I think there's some subset of kids who have an acute sensitivity, are highly empathic, and in fact, so much so that it can create a risk for them. And I'm thinking, of course, of conflict situations where being very empathic to hurting, making mom feel vulnerable or so on could be a real thing to be careful about or to watch for.
In that regard, if I could say what I say, and I don't mean to embarrass my wife, but she oftentimes reminds me that it's harder to be empathic with me when I'm angry. And I think that happens with teenagers and adopted teenagers as well. When we talk about anger and fear, it's harder to be empathic around those kinds of themes. That's part of what I took from what John was saying. It's easier to be empathic when your child is saying, "Oh, I love you. You're a great parent,"
or hurting.
Or hurting, yes.
Yeah.
And equally, that might be an issue thinking back to some of those high anxious, more cautious kids as well, that they're also embodying that, potentially embodying that empathic response, but not knowing how to actually manage that process and be willing sometimes to be able to go out there.
But, and it ties in with what Sally was saying when Sally said conflict in families. It's common. I mean, it has to happen. And I agree with her entirely. It's a practice area. And it's the same thing about being empathic when children, or adolescents in general, or adoptive adolescents, are angry or de-idealizing their parent or idealizing their birth parents. It's very important to be empathic around those sort of things so that kids feel like it's okay to have feelings that are different than what their parents have. And so, but it's just harder to do that.
I've got one more question over here, but let me just say that we know from research on empathy and arousal and pro-social behavior, not in adopted kids, but in typically developing kids, that when empathetic reactions trigger really high arousal, that reduces pro-social responding because you flip back to a protect yourself mode. This is work by Nancy Eisenberg. Moderate levels of arousal facilitate and support proactive behavior. So some of what we may be seeing with children who we think of as being highly empathetic is they're highly over-aroused by their feelings, and it's, again, our self-regulatory abilities that need to get raised to lower that arousal and so on. So one of the things I keep thinking, you guys want to bring research to practice, which is great, but I think we also have to bring research on typically developing kids, even though they're not done into our understanding of what's happening in which I know Hal and others have been doing, and not view these as totally isolated. If it's not done on adopted kids, it doesn't mean anything, kind of, because we're throwing away a lot of research then. So, I'm sorry.
Okay. We've got one here, and then I know we want to be empathic about lunch as well. So you've been waiting. Thank you.
Hi, thank you. I'm not sure where my question or comment will land exactly. I just wanted to thank you for bringing up the issue of transracial relations and development in adoptive families, and just wondered, in general terms, if you had resources that you could point parents to in all kinds of arenas. I'm thinking just this week of conversations that I'm having with my daughter's teacher. I have 4 African-American children with my partner, and my partner and I are both white women, and we live in this area, a largely white community. Just this week, having discussions with my child's teacher, who's 6, about the fact that she's telling her friends at school that she doesn't like her own skin color, and really trying to put pressure on the teachers who want this to be a problem that only we deal with at home or with our therapist, to really pressure the school to think about this as an issue for the school to address as well. That yes, we want to work on our daughter's racial identity and really encourage her to think of herself in positive ways, but that it's also the school's place to think about their curriculum, think about the representations in their classroom, and many other things. Think about the ways that they talk to my daughter about her hair, for example. And there's a real desire of white communities and white privilege to kind of say that not my problem. This is too hard for me. You go home with it. I'm not going to do anything about this. And just what resources are out there in terms of talking about how do adoptive families who find themselves newly engaging with race from the perspective of being in a target group, from the perspective of experiencing bias, experiencing internalized racism, and in addition to working on ideas of white, in addition to working on our own white privilege and understanding of inequality and bias and history and all of those things. But especially the thing that's concerning me right now is talking with my son about police brutality and just the difficulty of talking to a kid who has PTSD and, in your graph might be positioned in low functioning in some ways and then high functioning in others. A kid who's not necessarily ready to have this discussion about how targeted he is and will be increasingly as he grows bigger. I'm thinking of an article written by a woman on CNN that some of you may have read, that was emailed around in raising her own son, teaching him not to run. Just the difficulty of raising black children in a racist society, period, whether the parents are white or black or whatever the background of the parents is, but B, intersecting with trauma and racism being another vector of trauma and teaching your child, well, you're safe in my home, but actually it's not a really safe world. And I do have to tell you this, even though it's going to be a trigger, any response that you have would be really wonderful, in addition to kind of pointing to resources, in addition to the resources of socialization groups or parenting children of color groups that are available also in this area. Thank you.
And can I make one note right before you start? I just want to say to the folks over here who are going to ask questions, what if we'll close down after these responses and then you can come up here and we'll stay and we can talk. So I'm just noting our time. Okay.
First of all, I want to thank you for that question and sharing some of your experience, because I think it illustrates in a frankly, I think, overwhelming way the complexities that families face when raising children across race, across culture, children who have trauma histories, and who are doing it in a society where not everybody, and perhaps most people don't, feel comfortable acknowledging race and difference and addressing it. So I'm going to share some what may be random thoughts. They certainly were random as they came to my mind. Well, not so random, but it may not be a well thought out response, I guess is what I should say. One is that what did come to mind first are books that have been written by parents, by black professionals around some of these challenges, and those titles don't come to my mind right now, but I would be glad if you come up, I will be glad to email you those references, and if others want them, I will email them to help. Dealing with teachers and other professionals who have their own struggles is really, really hard. Well, I'm trying to figure out how to respond succinctly because I don't want to take a whole lot of time. And so I'm going to just say that, and I'm going to say that it's been my experience that at the same time that you have to push people to be ready, it's also difficult for them to do it if they're not ready, to take on partnering with you. But we do have to push professionals to be ready and to address. I would encourage you to try, before your son is an adolescent, and if he is now, do it now, to try and find a way to engage the police as an ally. That is to have a visit to the police station and talk with them about him, introduce him to them, what my experience has been, not as an adoptive parent, but as a parent of a child who we've had to have wonders about how he will handle some of these issues with police, given some of the special needs that he has. We've taken that tact of trying to help the police really know him better than him know them. But humanizing this in terms of the authorities, so that should they see your son, they may recognize him before they treat him as the black kid that they just see. I'm going to stop there. There's much more I could say and would be glad to talk with you about.
Thank you.
I would just add one more thing, is having your child have a lot of interaction with other children like them is probably, to me, the single most important piece of all of it. I mean, you already know what all the issues are. You're halfway there. So having them interact and have friends who are like them, I think, is really important.
And I guess the one other thing I would say is one thing that you are doing already, but I would really encourage you to do more, is really examine where you are and what you bring and what your triggers are and how you can manage those in the face of whatever comes up on any kind of day-to-day basis.
I'm hoping that these really important issues and the comments that weren't able to be brought out, you get to discuss over lunch and then this afternoon as well. Thank you.
Big round for the panel. This was great discussion and certainly plenty to talk about over lunch and for the rest of the afternoon. Just a couple of quick logistical things so you know what's where. I would like to mention that we have books from about 20 different authors available here for you to look at and purchase back in the corner. So if you're interested in looking at some of the books that we have for you by many of the people who are here in today's program, you're welcome to check those out. Also, there's an evaluation form in your packet, so please fill that out and turn it in by the end of the day, because we really do use your comments to improve what we're doing for the next year. So, about the important thing, which is lunch. Lunch is actually, the food is actually in the Cape Cod Lounge, which is out this door and to your left. So if you would go out, and there's some buffet lines over there, get your food and then bring it back in here. The cutlery should be on your tables, and the drinks and things are over there. And I understand there's both kind of main course things and soups and desserts, so you're welcome to go back and forth a couple of times. And then around 1 o'clock, I'll come back and invite people who want to make little promos about upcoming events and things to mention those. Okay? So have a really good lunch.